Malaria. I know mosquito net.
After decades of conflict, massive displacement of the population, widespread insecurity, and lack of public funding, the healthcare system, as well as the health status of the people of Southern Sudan, has suffered enormously. Though incomplete, health status indicators are grim. Estimated rates for maternal and child mortality are among the highest in the world. Malnutrition is widespread, vaccination rates are low, and tropical diseases, largely controlled in other countries, account for a considerable proportion of the total burden of disease. Therefore, in 2008, the government of Southern Sudan, with funding through the Multi-Donor Trust Fund, has implemented an ambitious project for scaling up the coverage of long-lasting insecticide-treated nets. The goal of this campaign was focused on reducing the malaria transmission in southern Sudanese states of Warab, Western Bahr el Ghazal, and Western Equatoria. In line with the Ministry of Health National Insecticide Treated Net Distribution Strategy, the campaign has aimed to have a high level of impact on malaria and achieving vector control in targeted states. In partnership with the Ministry of Health, Government of Southern Sudan, and the World Bank through the Umbrella Program for Health, Population Services International has been contracted to implement the program. The distribution has taken place in April and May 2008 and has been a real challenge due to logistical and infrastructure in Southern Sudan. More than 1 million long-lasting insecticide-treated mosquito nets have been distributed during this campaign, and 10,000 volunteers have worked on the 835 different sites.
Southern Sudan has taken a pragmatic approach and is distributing nets household to household, aiming to achieve a population coverage of at least 80% of everybody at risk of malaria. Now, this is quite different from what has been done in other countries, where the target is pregnant women and children under 5. In Southern Sudan, our coverage of health services is quite low and treatment is not easily accessed. So our mainstay of malaria control has to be a very strong vector control intervention. And with this approach, we are sure we'll be able to achieve very high coverage rates of ARNs and be able to interrupt malaria transmission. This is just the beginning with the MDTF ARNs distributed by PSI, and from the Global Fund Round 7, we'll be able to expand and cover all the population at risk in Southern Sudan.
The program is actually 100% or fully funded by government funds, and it's contracted to our partner NGO, PSI, to organize the logistics and the procurement aspect of the process of the project.
In the last year, PSI has been incredibly lucky to be working with the Ministry of Health, who is very committed to achieving large-scale impact on malaria, particularly malaria prevention and treatment, improving access outside of the health facilities as well as inside the health facilities, understanding that there's a lack of access to health facilities. What this campaign has done is bring very, very low cost, very accessible prevention methods to the communities and allowed them to have access to it.
Following the end of more than 50 years of conflict, this important initiative by the Ministry of Health, Government of Southern Sudan, is the first ever mass long-lasting insecticide-treated net distribution in Southern Sudan. The main concerns of this campaign were multiple: increase the availability of insecticide-treated nets, promote the benefits of ITN product attributes, increase knowledge on transmission and prevention, and increase the perceived severity and susceptibility for key target groups as pregnant women, children under 5, and returnees.
Malaria is the most important parasitic disease, causing up to 2 million deaths every year, majority in sub-Saharan Africa. Within society, there are certain groups who are more vulnerable than others. These include children under 5, pregnant women, and in the context of Southern Sudan, returnees. These people are particularly vulnerable, either due to immature or weakened immunity. On the African continent, it is estimated that a child dies every 30 seconds as a result of malaria. And in the eastern and southern African regions, 30% of deaths during pregnancy are attributable to malaria.
Malaria is a very common disease in Southern Sudan and in particular Warab states. So the malaria is known, the impact of malaria is known by everybody. So people are really very happy that they will get nets to protect them from malaria.
In Africa, 75% of malaria deaths occur in children under 5. This group is considered to be the most vulnerable, as a result that they have not developed protective immunity due to limited exposure to the disease. In an area of high transmission, such as Southern Sudan, this means that children are more likely to become infected and that the infection will actually lead to severe malaria.
Malaria, dam tabanu me diargo, ko damango, ko salad, ko yolani, anga, matin, malaria lumi.
In areas of high transmission, adults have developed a certain level of protective immunity against malaria as a result of repeated exposure. However, during pregnancy, this immunity is weakened, making pregnant women more vulnerable to the disease. In an area of high transmission, during pregnancy, the clinical signs such as fever may not necessarily be present, and the main impact of malaria is maternal anemia, which results in many deaths. In addition to the risk to the mother, there is also a great danger to the unborn child, and malaria during pregnancy can result in miscarriage, low birth weight, or developmental problems in the unborn child.
Na napsu kan diaria tayin tay janawan cina lemtian man pat enen ke ciman yi ga lir den dit le bi dial dam malaria tayira le mana lor lemtian pat so ka en kan ci be ban le be ban dam en dir be ban yang malaria ban cái bên cái ban yang malaria rang na la ka bên ban yang tan di ra ban be la teng wala sa sia wala kona ka chi la ban do me di dam ben ke yet ku tem ku chen ka nom tar ger ku chen ka yai ten ban la ror kana chog ye wal ban ki lo.
In Southern Sudan, there are many returnees. These are people who sought refuge during the conflict years in neighbouring countries and who have now come back. These people are particularly at risk because the neighbouring countries have a lower level of transmission than South Sudan. So the level of immunity in these people, may they be adults or children, is considerably lower. As a result, when they come back into an area of high transmission, they're more at risk of actually contracting the disease, and with low immunity, it is more likely that this will lead to severe malaria.
Sana ethnin tamanin wala chumal kumanta ga en kian ya la cheng tin la ka de ya lo ben kan ana cheng wala ni la biet pani chol kusi ku tanywe na ga le bia yen malaria tanywe na ga le bia
ko wa pa yin cheng long chumal malaria de ma chuwa ma de kwa ni malaria ta ba na lu bada ke bauda kujala gida ne tolde ngatwe ko ga bo pen wani jitin yan kinin mahim tinu ga sa o kayun chak tum ni anu mi kujala ka chirwal walun ge wal panaki yin man bi o ke rawa to dom pai anu me daru ro ran di daru ro la ko chinan ran che tom ge rawa li wala ge rawa ke ge to go ko wa go sa du en kan.
I had malaria myself, and it's a very very painful experience. And actually, I had it long time ago, but it's chronic. So every time my immune system is down, it will kick back again. And just last year, I remember I had one, and it was really bad. You feel just very tired. It wears you out. It pain on the joint, and you feel you don't have any energy, and there's pain. And the worst feeling that I hate about it is that you feel lonely, and you feel you can't do anything, and you can't be like anyone living your normal life. And also that just you value health really at that time. You know what health means to you. As a returnee, life can be very difficult. You're being transported from the north or from wherever you live and coming back to a new area. And as a returnee, most of us lived away from this area over 20 years. Some of them, it's the first time in their life to come back home, the home of their parents. Actually, my mom and my sisters and brother just came back from Khartoum. And obviously they come with nothing, and also it's hard. They don't know the area, so they don't know what to carry with them. That's if they have the ability to buy things like mosquito nets. So as a returnee, one of the most important things, yes, that they would use would be mosquito net. It would be a blessing, especially they're not used to this kind of weather, rainy weather. They're not used to this new area. It's a new experience, so it takes them longer to get used to and figure it out.
Long-lasting insecticide-treated nets are one of the most efficient ways of preventing malaria because they're inexpensive and you can distribute them broadly to a large sector of the population. If you achieve a certain level of coverage, you can actually have an impact on malaria transmission in the malaria transmission season. So what we're aiming for in the campaign that we're currently doing in Warrap State is looking at 100% coverage of the entire state.
The pre-registration was a process whereby all households to be covered have been registered and have been given a voucher stating how many nets they had to receive. The information gathered from pre-registration has been collected so that it was possible to determine the exact number of nets that each side needed. Pre-registration was also for social mobilization. The recipients have been told on what day the distribution was taking place. Distribution sites were planned throughout the counties, and each site has covered around 250 households. Each site is staffed by 12 personnel, 1 supervisor, 3 health educators, 2 registrars, 2 distributors, and 4 security personnel. Health educators have selected a group of 25 to 30 people and went over a health education lesson where they have focused on transmission, at-risk groups, and prevention. From health educators, the recipients have moved to the registrars where they have been recorded. They have then moved to the distributors where they handed over the vouchers they have been given during pre-registration. As not everyone in the household has received a net, it was important to provide effective health education at the sites so that people can make an informed choice as to who in their household they need to prioritize for. With education, the nets are more likely to be used correctly.
I think some of the main challenges that my team has faced has been transportation and logistics. It's been the fact that there's no information on population data. We had a number of micro-planning meetings at state, county and Payam level, and every time the issue of population was brought up, nobody could agree on what the population was. This means that some of the pre-positioning that's necessary for a net distribution and for calculating the number of communication materials that are needed, identifying the number of volunteers, distribution locations, etc., becomes considerably more difficult when you don't know how many people actually exist in the state. Because of this, we had to look at changing some of our normal approaches we would use in other countries and carrying out a very thorough pre-registration process, which is in a sense like doing a census in the state, just for the net distribution. Factor this into the fact that the majority of our target group is illiterate, that a lot of the volunteers that we're working with have a low level of literacy. They're not illiterate, but they don't have a high level of literacy. Malaria knowledge amongst a lot of the volunteers is very low. And a lot of the volunteers are taken up by other activities, by other organizations. So for instance, we had to delay our distribution because this is the first time that Southern Sudan, it's the 5th ever housing census for all of Sudan, and this brought about a 2, 3, 4 week delay in the programming, which the census is incredibly important, but the rainy season here is very, very short. So the time we have from when we start planning distribution to actual distribution, sometimes we only have a window of a few months. One of the northern counties in Warp State where we went to, called Twitch, has a very short rainy season, very short dry season, sorry. There are some areas in Twitch that only became accessible in April, and then we lost access to at the end of April. So you can imagine some of the challenges this faces a team that's looking at distributing 1 million mosquito nets in a very large geographical area, of which we don't have any idea how many people there are, and you're fighting a rainy season that's coming very, very quickly.
And then also the transportation, because we have to move the nets from Juba to Warab states and then to counties, from counties to Payam, from Payam to Buma, and from Buma to the sites. And it is really very, very expensive. Sometimes the trucks owners refuse to go to the site because of bad roads. And when we convince them, they charge us very highly, and it is really very, very expensive. Another issue is the issue of some tribal conflict, whereby the population have been displaced, and when we go to some places, you cannot get people because people have run away. Example in Gorial East and some Payam in Gorial West. So the issue of tribal conflict is also a challenge within the area.
Southern Sudan has selected RRNs as the main malaria prevention intervention because our capacity is at the moment to do indoor residual spraying and environmental management is quite limited. And so the government is committed and partners to expand the intervention to cover everybody at risk of malaria and achieve at least 80% population coverage. We have about 5.9 million nets coming under Global Fund Round 7 malaria grant, and many partners, including the Multi-Donor Trust Fund, MDTF Phase 2, have put funds to secure more nets. So the future looks bright, and we think we'll be able to attain the coverages that we have stipulated in our control strategic plan.
South Sudan will need many other successful campaigns like this one to ensure sustainable high coverage with long-lasting insecticide-treated nets as vector control strategy for prevention of malaria transmission. This strategy will reduce burden of malaria among vulnerable population.